Hello. Today we are going to discuss speech therapy for memory and the impact of COVID-19 on speech and swallow skills. COVID-19 has the ability to wreak havoc on your ability to speak, breathe, vocalize, and swallow, due in large part to weaknesses in the respiratory system. Speech therapists play a vital role in rehabbing COVID-19 survivors and those with memory or cognitive deficits. Have you ever lost your keys or your wallet, forgotten why you went into a room or why you went into the kitchen? There are ways to help trigger your ability to remember. Brain changes can lead to difficulties with memory, sustained attention, encoding, and recalling of information. Speech therapy can help to create positive changes in the brain to increase your long-term recall skills. Different disorders can lead to cognitive and memory deficits. Some of these disorders are dementia, Alzheimer's, ALS, Parkinson's, alcohol abuse, progressive aphasia, and also COVID-19. COVID-19 itself can lead to documented brain fog, difficulty thinking or organizing your thoughts, memory difficulties, muscle tension, overexertion of muscles when speaking, voice deficits, and even swallowing deficits. For swallowing, the loss of taste and smell has a big impact on what and how much you eat, as well as the foods that you choose. Both of these negatively impact your nutrition. Difficulties with textures mean that you may choose to avoid certain foods and only eat those that you can taste or smell, and you may not get the appropriate nutrition or hydration to maintain your health. Strong respiratory muscle strength is needed to drive the cough reflex, which in turn helps to protect your airway and expel items that get into your trachea or your lungs. Without this protective mechanism, you are at an increased risk for penetration, aspiration, pneumonia, and other infections. After being intubated, you can also risk damage to the larynx and trachea, such as scarring and inflammation, which can affect your swallowing and your voice. Speech therapy can address all these areas. We're going to talk specifically about memory. Memory is the process of encoding, storing, retrieving, and reporting of information. There are different types of memory. Immediate memory is the ability to retain information long enough to write it down. Think of phone numbers, doctor's appointments, messages from friends calling. Working memory is your ability to take in the information, hold on to it, manipulate it, and then act on it. You might think of recipes. Do you have the right ingredients? Do you have the right amount? What else do you need to buy? Short-term memory varies day to day, and this involves your everyday routine, remembering items from conversations, remembering appointments, any conversations you had throughout the week. It has limited activation from earlier in the day. Long-term memory is relatively permanent. You want to think of your childhood memories, your wedding, things that have been a few years back. Those are all going to be your long-term memory. Long-term memory tends to be easier to remember. Okay, those events have been in your mind longer, and it's a lot easier to fall back on those. In fact, some people who have memory deficits may turn all conversations to past events because that's what's easiest for them to remember. Prospective memory is the ability to recall information or plans for things that will happen in the future. Your memory systems need to be able to function in two ways. They need to work as storage, such as remembering numbers, and also as processors, so that they can remember the numbers and then add them together, for example, at the grocery store. Simultaneous storage and processing is required for successful comprehension and follow-through. This involves different cognitive skills as well, such as attention, concentration, and sequencing. How can speech help? We use different memory strategies to help give you the tips and the clues to access the information. Examples of these are rehearsing and repeating the information, chunking information together, such as you would do with a phone number. You remember the area code, prefix, and suffix. Restating or rephrasing some information that gives you more time to process it and you hear it in a different way. Sequencing and listing steps. You might want to write down your morning routine or steps involved in transferring so that you don't miss those little tiny baby steps. Summarizing information, getting a mental picture in your head, your organization skills, and writing things down. An acronym to help you remember these strategies is WRAP. The W stands for write it down. The R stands for repeat or rehearse the information. The A stands for association. You want to group those items together by like categories to make it easier to remember. And the P stands for picture. Get that mental picture in your head of the information you need to remember. Systems that can be put in place to help your memory: calendars to track your times, events, appointments, journal books to write down daily activities, log your medications, meals, any activities you attended or need to attend, and any visitors. You can write down schedules for doctor's appointments, bill paying, medication lists and tracking systems to go along with a weekly pill container. There can be environmental aids, signs that you can put up for using your walker, your call bell, phone numbers, even where you are. Some people tend to be a little bit more disoriented when they wake up, and they might need a sign saying where they are, what the date is, reminders that they're safe. Note-taking and whiteboards are also important for memory. It's good to have a whiteboard by the chair where you sit so that if someone calls and leaves a message, you can write it down right away. You can take notes with you for a doctor's appointment. Things like that to have as a review when you need that information. Task breakdown is important. You want to break down anything that you need to do into baby steps. A lot of people might forget turning on the water for brushing their teeth or putting the cap back on the toothpaste afterwards. So just reminders of those little steps help the memory. Life history books are used a lot with dementia patients, and they can be pictures or words describing milestones or family events and people. Repetition is key for memory. It's important to create routines. If the task requires less cognitive demand, it's going to be easier for the person to remember it and complete it with greater independence. Routines such as your morning routine, grooming, setting or clearing the table, folding your towels or clothes, those can all be established and give someone a sense of purpose and task completion. Memory changes are evident with dementia and Alzheimer's as well as normal aging. So that's where these picture journals of family vacations, holidays, etc. come into play. And these books can also be used by visitors or grandchildren to help engage a patient or a family member in conversation. Memory does not get better. However, we learn strategies to compensate, which in turn increase our overall performance, function, and independence. Speech treatment also can address motor planning and executive function to create those changes in the brain. It can be drill-based activities, it can be exercise programs, it can be even oral motor exercises for swallowing deficits. So if you notice that you're having any memory problems or voice problems, difficulty managing your daily routines, your medication, your finances, any of those are ways that speech can help you. So therapy can be set up to address your specific deficits, swallowing, voice, language, and help to increase your independence and your performance to keep you at your highest level of function. Please call therapy to request an appointment if you have any concerns about your own function. Thank you very much.